Days before the House's historic healthcare reform vote, the Virginia Organizing Project brought voters from Virginia to Capitol Hill to tell their stories and opinions on this critical issue to their members of Congress.
I think it went really well.
I felt like we had very receptive listeners thus far.
I thought it was well done. He was very informative, and he entertained all sorts of opinions and ideas from the group.
I felt like we were heard, and that's what we wanted when we came here.
His staff certainly seemed receptive to us, but I'm not sure that we're completely clear on where he sits in terms of the public option. But I was at least encouraged by what I heard.
I would have loved to have had a guarantee that a public option would be included in the health care bill, but I know that he's not able to provide us with that.
They're in a place where we still need to keep pressure on them, but I do feel they're committed.
They wanted to stress the connection between healthcare reform and the country's greater financial stability.
We, as the richest country in the world, refuse to pay for decent health care.
We're one of the wealthiest countries in this world, and I really believe that we can do a better job.
The issue of affordability, the rising costs, the premiums, the co-pay issues, the wage issues with people's families being, people being forced to be put in situations over health care just to live.
We are already paying for medical treatment for the indigent. It's coming out of our taxpayer dollars, and it's coming to us for the people who do have health insurance through higher premiums, higher and higher every year.
That's what people need to focus on. We're already spending the money, but we're not spending it wisely.
In addition to their financial arguments, they also wanted to express the greater moral need for expanded health coverage.
We need to do something to change our health care, and it needs to be done now, and that it needs to be something that's accessible to all of our citizens.
Healthcare is an issue that affects everybody, no matter race, socioeconomic status, whatever it is. It's an issue that affects everybody.
What we've forgotten as we have focused on wealth and accumulating power is that we are responsible for our brothers. We are our brothers and sisters' keepers. And, we need to get back to that.
It's the humane thing to do. We need to address this issue of healthcare and come up with something that's going to help us out right now and help us out for years to come.
We are at a matter of survival. We need to fix this healthcare system that's broken, and we need to fix it now so that quality, affordable healthcare can be provided to every American in this country.
No matter their impact, they were grateful for the opportunity to give their elected representatives the people's opinion.
We need people to stand up and have their voices heard. That we need some real strong healthcare reform in this country.
Regardless of what kind of impact we've had today, I feel like the big thing for me is that I've taken control of my own concerns. I've allowed my voice to be heard, and that gives me some power in the situation.
A lot of people don't think in terms of my generation or younger generation that people are not concerned or we don't care about the issues when, I'm part of that generation. I do care. I wanted to know what can we do right now and what can we do for years to come.
I've had the opportunity to say to our representatives that I have something to say to this. I have a stake in it. And so somehow that feels like I'm less powerless.